Hey, it's Raj from 3CB. Tennis legend Rafael Nadal is dealing with persistent and ongoing left foot pain due to Muller Weiss syndrome, which he's managed since 2005. Watch my video on Muller Weiss for more information on it. The pain got to the point that Rafa used nerve blocks to numb his foot during the 2022 French Open. I also have a video on that if you're interested. Rafa admitted after his title win that it wasn't a viable solution or treatment going forward. As a potential solution, it's been reported that Nadal will undergo radiofrequency RF ablation, in which a small hollow needle with an electrode on the end of it is inserted into a targeted nerve and heat produced from radio waves, hence radiofrequency, to damage the nerve and inhibit the pain signal up to the brain and thus provide pain relief. RF ablation is considered for chronic persistent joint pain that hasn't responded to other treatment, and when a nerve block results in pain relief, which indicates that a targeted nerve treatment is effective. Both of these are true in Nadal's case. In the foot, RF ablations are typically used for neuromas and for heel pain, and often requires a series, often 3 treatments, depending on response. To that point, Rafa recently had his first one and was seen on crutches in Barcelona, commenting that they'll know more in a few days. Research in these cases are relatively promising, with most having pain relief and over 90% satisfaction. However, data and research on its use for the talonavicular joint affected by Muller Weiss syndrome is sparse, and even more so for elite athletes who load the foot and ankle at a much higher rate. It's pretty clear that Rafa is trying everything within his power to deal with a foot issue that is getting worse and will only continue to deteriorate. There's no tangible way to solve the root cause of the problem, so now it's how do you best manage the symptoms. I'm sure many will decry the move, but remember, Nadal is someone who has managed tendinopathy in both knees since he was 21, has managed his left foot for 17 years, and dealt with an assortment of other overload injuries. He's been walking a risk-reward tightrope for 15 plus years overall, and will continue to do so. He may even tilt more towards risk as he sees the end of the road approaching on his career. The same incredible resilience and competitive mentality we see on the court, and many admire him so much for, also applies off of it. He will do everything within his reasonable power to continue playing. It's that competitive drive that made him the legend he is. I'll keep you updated as we learn more.